Yeah. Okay. So we have three types of letter: referral letter, discharge. Sorry for the spelling mistake here. Oh goodness, wait. DISC. I'm terrible at typing. DISCH. Yeah, discharge letter, transfer letter. Now, so let me just recap everything so that we're on the same page. So initial 5 minutes, that's the reading time. Please do not start marking on the question paper. And the rest of the 40 minutes, you are supposed to be producing a letter that is 180 to 200 words, plus minus 20. And there are three types of letters that we have. We have referral letter, we have discharge letter, and we have transfer letter. Now, I've written that in a descending order, which means referral letter is the most common type of letter asked in OET. Then discharge letter, in my experience, comes every 6 to 10 months, and transfer letter every 2 years. It was asked last year, transfer. That means maybe there's a possibility of the transfer letter coming next year. But we will be practicing all of them. But you have to understand the fact that referral letter is the most common type of letter that's asked in the examination. Okay. So referral, discharge, and transfer. Let's go to the next page. What's the difference? Yeah, it's very easy actually. So see, I don't know if you're aware or not, but what happens in Nepal, India, Sri Lanka, Pakistan, Bangladesh, or like South Asian countries is that if you get sick, you directly see a specialist. Like you pay 850 rupees. Yeah, that's the current rate in Nepal, Kathmandu. So you pay 850 rupees, you can see a neurologist if you have a headache. If you have a stomach ache, you can see a gastro, you can see internal medicine, you can visit a neurosurgeon, you can visit anybody if you're paying money, isn't it? This is what happens in Nepal, right? But in other countries, especially in the UK and Australia, where this examination comes from, you cannot see a specialist directly until and unless it's very, very urgent. So the first professional who is going to see the patient, if there are any issues, even if you have a finger cut, yeah, you have a headache, you have a stomach ache, the first person to see is always a general practitioner. And if the general practitioner deems it appropriate, then only the GP or the general practitioner refers to a specialist, a relevant specialist. Otherwise, they try to sort the issues at the primary level. That's why they have insurance-based medical system in Australia. But if you go deep inside Australia, like suburban Australia, that's a government-covered healthcare. And same thing happens in the UK as well. They charge, they cut certain tax and they give you free healthcare and education. So this is the bad part actually. So you cannot see a specialist straight away. So GP to specialist. Yeah. So if GP thinks, yes, okay, let's refer the patient to a specialist, then only the referral happens. Otherwise, the GP is going to handle the patient. Yeah. So basically, OET writing is a letter that's written between GP and a specialist. Yeah. So let me write it here. A specialist can be anybody: orthopedic surgeon, neurosurgeon, neurologist, endocrinologist, pediatrician, a radiologist. Yeah. So a specialist, GP and specialist. Yeah. So when the letter is in this black direction, when it goes in this direction, left to right, this is a referral letter. And when it's vice versa, a specialist towards the GP, this becomes a discharge letter. Are you understanding, Rupesh?
Yes, sir.
Yeah, remember this. So there's one more thing that I want to add you. Like, what is the difference in writing a referral letter and a discharge letter? So basically, when a GP refers to a specialist, the specialist sends the patient back to the same place where the patient came from. That means the GP is already acquainted, knows everything about the patient. So you do not need to write any medical history. Like, for example, you are the GP, yeah? It says on the question paper. That means it's automatically a referral letter. If it says, oh, you are a surgical resident, that's automatically a discharge letter. So GP is the one who must have referred the patient to you, and then you're sending the patient back. You're discharging the patient back after keeping the patient hospitalized maybe for 10 days, 15 days, it doesn't matter. So You do not need to tell the GP that, okay, the patient has been hypertensive for 5 years under medication and blah, blah, blah. The patient lives in this area, that area, has a wife, son. You do not need to talk about all those things because the GP is already known about the patient's condition. Yeah. Anything new that he did while the patient was hospitalized, that's called a that's the only content that you're going to include in the letter. Yeah, that's the difference. Now, transfer letter, it's the third type. What is a transfer letter? Let me give you like the most common type of transfer letter that they ask in OET. There are many kinds, of course, 2 or 3 kinds, but the most common one, let me tell you. Let's imagine that I'm here in Kathmandu at the moment, and let's imagine Chitwan. Yeah. Let me tell you a story, short story. So there's this guy, let's say Mr. X. Yeah. So Mr. X here, he lives in Chitwan. No, he lives in Kathmandu, sorry. Yeah. So he has been diabetic since 2016, and he has been under metformin and all the relevant medication, and he's controlling the diet. He takes care of himself. He's involved in all the daily activities and all. He takes care, very very good care of himself. But who was the primary caregiver? The wife. So what happened to Mr. X is that his wife passed away in 2022, and after that, his health condition started deteriorating. Yeah, he started drinking alcohol. He started missing medication. He started eating junk food. He doesn't know how to cook. Earlier, wife was taking care, but now he doesn't have anybody. He has a daughter, but the daughter lives in Chitwan. This is Chitwan. This is Kathmandu. So the daughter got really concerned about the father's condition. So the daughter came here and said to you, like the GP here, so see, doctor, I want to take my father to Chitwan. Because there's nobody to take care of my father here. So I think it's better that I take him. So can you write a letter? So this GP will find another GP in the area where she lives. So this letter becomes a transfer letter. So remember, whenever there are 2 cities involved, and it is not because of your expertise. It's not that you are not able to take care of the patient. The patient's family or the patient himself demands that, okay, I'm leaving this city and I'll be living in Chitwan from now on. That becomes a transfer letter. Yeah? Clear? So it becomes a GP to GP letter, most commonly. Yeah? Sometimes it also can be like GP to another specialist. Like, for example, this Mr. X had some sort of cancer and had chemotherapy in Kathmandu, but he has nobody in Kathmandu, so he's moving with his daughter or son in Chitwan. Then you, as a GP, can write to oncologist in Chitwan. That also becomes a transfer letter, or sometimes referral as well. Yeah. So remember, 2 cities involved. In my experience, the referral and the discharge usually happens inside the same city in OET. But whenever you see 2 different cities, and when you see that, oh, GP to a GP, another general practitioner, that becomes a transfer letter. Okay, so let's say 99% of the time, at the bottom of the letter when you go, they already clarify what kind of letter that is, so you don't have a headache. But there's still a chance, 1% chance, where they do not tell what kind, where they do not tell, when they do not tell you the type of the letter, and that time you don't be confused. So they will always start a question paper saying, oh, you are the GP. That means it's a referral letter. You are the specialist. Oh, that's it. A discharge letter. I went 2 cities and you see another GP receiving the letter. So you have to think, okay, that's a transfer letter. But I've told you that when you go towards the bottom of the letter, they will already have the instructions given. This is going to be your task today. So we are going to have a discussion about this one. So it already says here, see, using the information given in the case note, write a letter of referral. So no headache. Associate Professor Simon Anderson, surgeon. Surgeon is a specialist and you are the GP, isn't it? They tell you at the top. So Mr. Daniel McCree is a patient in your general care. Do you see this at the top? Yeah? That means, since Dr. Rupesh, you're writing the letter, so obviously you are the GP. So you're referring the patient to a specialist. It is a referral letter. They can hide it also sometimes. They will not tell you towards the end, here. whether it's a referral or discharge, but you can understand by yourself. You get it. Now, what I want you to do is, can you please read this by yourself? You don't need to make any sound or anything. Just read it a little bit. Just get acquainted. And I'll tell you how to convert this thing into writing.
Yes, I've read this.
Keep reading.
Yes, I have read.
Check this last part.
Yes, sir.
Okay, so you understand. So actually, it's not called a question paper. It's called a case note. So you must be seeing this, that we have dates. That's the first visit, and that's the second visit, and that's the third visit. And that's at the third visit, we decided that, okay, we cannot take care of this patient anymore. Our center is not well equipped to take care of the patient. So maybe I should be sending the patient for a better assessment, better expertise. And that's the time when this referral is happening. Yeah. So they give you a lot of information. See, so basically what you have to do is that you have to convert this into a question paper. It's a past question paper. See, it's from 2014. You have to convert this into a question paper. That's not a question paper answer. Now I'm going to teach you how does that happen. Okay. Let me show you. So here you go. So this is just for the format, okay? This is one of my old students writing. So no matter which profession, no matter which kind of letter, the format is same. Yeah. Let us discuss a little bit. Okay. What's here and what's here and what's there. So look at this one. So I think everybody knows, since we were kids, I guess we have always written some sort of application to the principal. We've written application to the class teacher. Growing up, we have written letters to the university. We have written letters to the head of the department. We have written letters to the, the director of the hospital, right? And you must be noticing there's one common pattern that the left-hand side top corner is always dedicated to the receiver of the letter. Whoever receives the letter, their detail is going to be given, right? Do you agree with me? So whoever receives our letter, his or her detail is going to be on the left. So the letter that the case note that you read a while ago, it had Dr. Simon Anderson or something, general surgeon. So his information you're going to copy paste from the question paper and keep it on the left. So this information is known to everybody, even my daughter, who's 5-6 years old. And you also know this. So this is not a new thing that I'm telling you. But we Nepalese, Indians, and like South Asians, we have a habit of writing date here. Yes?
Yeah.
But OET doesn't accept it there. OET accepts it here. This is a new thing that I'm telling you, but we know for fact that there has to be a section where we have a letter. So where we have a date. So OET accepts it here or here with one line space, of course. So Mr. Paul Ferris, one line space and then date at the top. Yeah. So this is a known thing to you. This is a new thing to you. And this one also is a known thing to you. Dear Mr. Ferris, Remember when we used to write to the principal, respected sir, madam, respected ma'am, respected sir, dear sir. Same thing here as well. Yeah. So
Yeah.
this one. So this green. Let me mark it like this. This is known to you. This is also known to you, and this is a new information, and this is also new information. So remember, in our application, we used to have subject. Give me 4 days off. My sister is getting married. Give me 5 days off. I've been having some stomach issues, something like that, right? But we don't have subject. So this is the new information for you now. So instead of subject, we have RE. What's RE? It's reference. You can also write REF. So what do we write here, basically? We write patient's full name. It's going to be given on the case note, isn't it? And you can also put a comma and write date of birth here if it's given on the question paper, right? Now, a while ago, I told you that it's 180 to 200 words, right? So nothing is counted. Let me change the color. Right. Let me purple. Nothing's counted. Counting begins from here. Actually, not even from here. We'll talk about that later. But just remember, till RE, nothing is counted. This area. This is just a prerequisite. You have to fulfill this, irrespective of the type of letter that you write. You write referral letter, you write discharge letter or transfer. You always have to copy paste this information from the case. Yeah. Okay. Okay. Let me remove this now. Now there are a few other things that I'm going to tell you that you know since you were a child, you're a kid. Let's go towards the end of the letter. Remember, we always used to write this, isn't it? If you have any
Excuse me, sir.
if you have any queries regarding blah blah blah, please contact me. We always write, isn't it? This is also known. And yours sincerely, yours faithfully. We've been doing this for forever. So this is also not an old information, not a new information for you. Old information. The new information for you is that this is also not counted. You're getting me, right?
Yeah.
Okay. So it's just a formality that you have to do this if you have any queries. Now, before the formality, we see this. There is a little paragraph here. It says, considering the above. It's like, how do you translate this in Nepali? It's going to be uparokta sambandhama. Yeah. This is the ending of our letter. That's our conclusion. And obviously, the first paragraph is going to be a beginning of the letter. Yeah. This is the beginning of the letter. So let me tell you a few things. So if there is a beginning, there is always going to be an ending. We've written so many essays in English, right? If there is a introduction, there's going to be a conclusion. If there's a beginning, there's going to be an ending. If there's a North Pole, there's going to be a South Pole. Yeah? If there's a first paragraph, there's always going to be a last paragraph, isn't it? So this is the first paragraph. This is also called beginning. This is also called introduction. So while we have our classes, I'm going to refer this as North Pole jokingly sometimes. So sometimes introduction of the letter or sometimes first paragraph. So please don't get confused. And then we have the other end, South Pole. That is going to be our closing of the letter, conclusion of the letter, ending of the letter, last paragraph of our letter. Yeah, I hope we're clear. Now let us go and put our focus effort on the beginning and ending. What is the requirement of beginning and ending? And then we'll talk about the other paragraphs. Okay, so let's see. You can note this thing down if you want. All right, so let's see. So what is the, see, this is a very common format. Everybody writes like this, and there are many other formats. I think you're a doctor by yourself, so you will do a little bit of research also. There are many ways to write, but I'm going to tell you the most common way to write. I am writing to refer. If it's a referral letter, discharge. If it's a discharge letter, transfer. If it's a transfer letter, here it is. Please forgive my typing, TRANSF here. Transfer. Mr. If it's a man, Miss. It's Miss. It's a female. Female. It's a woman. Or if it's a married female, MRS, or you can even write MISS, Miss, for somebody who's young, like 16, 17. So blah 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 blah. Who has a She requires B. So let me tell you a few things about the introduction of the letter. You should not be writing more than 40 words, which doesn't mean that if you write 41 words, they will kill you. I would try to keep it somewhere around 40, 40. And always write it in two-sentence format. So here, look at this. I am writing to refer Mr. X who has blah, 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 and needs blah, blah, blah. We could have also done that, right? We could have done that in a single sentence format. But I am encouraging you to not do that. Always write in two-sentence format. I'll tell you later, once you start submitting your homework, then you will understand why I'm telling you this. It is to protect you from making mistakes with grammar. All right? Now, the question arises, what's A and what's B? A means ongoing issue of the patient. Ongoing issue of the patient. What's going on with the patient? And B is, what do you want from the reader? It's very easy, actually. Ongoing issue of the patient. So where will you find this information? In diagnosis, obviously. Maybe it's going to be a provisional diagnosis. We are unsure. Maybe it's cholelithiasis, maybe it's cholecystitis, maybe it's gastritis, maybe it's pancreatitis. We don't know. We're suspecting all of them. So we're sending the patient to the expert to exactly pinpoint what is happening to the patient for a better treatment and diagnosis. So you will always see in the diagnosis, there is going to be a section on the question paper that is a case note where you will see DX or diagnosis. You basically copy paste that, right? You don't have to use your brain. You just copy paste. It's a copy paste game. And B is, what do you want from the reader? It is always given in the writing task or towards the end of the letter, before writing task, on the last visit. So the case note that we read a while ago, it also consisted of 3 dates, remember? And there was a latest date towards the end. And in that date, it will be given what do we exactly, or on that date, it will clearly be written, what does the reader have to do for us? Copy paste. If it's not given there, it'll be given in the writing task. So you don't have to hunt throughout the letter what is going on with the patient. Are you understanding me? So no matter which question paper or which case note you have in your hands, your responsibility is to find out what is A and what is B. It's like, you're building a house, you're building the base. If you mess up with the base, then you'll mess up with the whole house. So this is the first layer of the bricks that you're laying, or not even bricks. What do you do under RCC? Yeah, dhalai bhन्छ ni Nepali. So this is the first job. Now let me also tell you about this is the beginning of the letter. That's the north pole of the letter. Let me talk to you also about the south pole of the letter. South pole of the letter is like this. See, in light of the above, in the letter that I showed you a while ago, there was considering the above. Yes, these are the common ones. The above, or a lot of people also write in view of the above. And you can even just write I would appreciate. That's also fine, but like this is it literally translates to Uparukta Sambandhama. It should always have request. You should not be writing more than 20 to 30 words, not more than 2 sentences. It should not be like a big paragraph with 50, 60 words. The ending of a movie always in the movie. So only one request, or maybe 2 requests at the most in the closing of the letter. The introduction of the letter can be synonymous to trailer of a movie, short and sweet to attract. Closing of the letter is like only 1 or 2 gunda in the end. Yeah. So you just simply write one request. In light of the above, kindly manage Mr. Mrs. blah blah blah. Done and dusted. That's a formality. Okay. Are you understanding till now?
Yes, sir.
Now, between these 2 ends, North Pole and South Pole, we have other paragraphs also. You noticed in the one of my students' writing I showed you, there are other paragraphs as well. They're body paragraphs, and you can write somewhere around 70, 80 words per body paragraph. It's big, isn't it? Now, what do we do with this? So here, let's look at this question paper, the case note. Yeah, look at this one. So we have 3 visits in total. Look at that. First one is September 19, 2013. This is a past question paper. That's why the dates are all day. On the day when you sit for the exam, the date is going to be framed as per your examination date. So don't be concerned about this. Then we have 13. Then we have another visit on Feb 8th. Then we have Feb 22nd. 8th, 18th, 8th, yeah. And Feb 22nd. So yeah, we have 3 visits. Now we have to manipulate these 3 visits into making a letter. Now, how are you going to make? That is the thing that we're going to talk about. Okay? Now, note it down. Very, very important. Discharge letter, transfer letter, and urgency. Okay? Discharge letter, transfer letter, and urgency. Discharge letter, transfer letter, and urgency. The second paragraph is always going to be today. Today's visit. This is today here. I mean, it's 2014, but it's 2024 now, 10 years later. But you understand, right? This is the latest date on the question paper. So this is today, obviously. This is leading to referral. So in a discharge letter, in a transfer letter, and in urgent letters, when you write to emergency department, when there's a case of ectopic pregnancy, for example, when you have like a child super dehydrated or myocardial infarction, in this kind of cases, remember that today means sabhana naya date. The newest date on the question paper is going to be the second paragraph. It's a rule, and you have to always do this. It makes sense as well. See, if I'm having pain right now due to appendicitis, why would he talk to me about the 3 or 4 visits that I had 1 year ago? You're going to talk about the pain that is happening at the moment, isn't it?
Yeah.
So urgency happens, and sometimes they don't tell you if it's an urgent situation. You can also consider a case note urgent by yourself. It doesn't matter. In this particular case, it says ASAP. You see, this is also an urgent letter because there's a chance of malignancy. There's a chance of cancer, carcinoma, right? So obviously this is your second paragraph. So first paragraph is the North Pole. After North Pole comes Feb 22nd visit. That's today's visit. And then after that, you can write this visit and you can write that visit.
So referral letter also becomes urgent here.
Yeah, obviously it's urgent. You see, you say ASAP, it's written at the bottom. Like, for example, somebody had a stroke, myocardial infarction, they're suspecting somebody's having MI. Don't you think that's an important, it's an urgent letter? It is.
Yes.
Yes, if somebody's having ectopic pregnancy, don't you think by yourself? You're a doctor, isn't it? So it is an urgency. No. Appendicitis, urgency, yes or no? Yes, obviously it's yes. Somebody had a trauma, motorcycle crash, urgent or not? Yes. So you get me, right? So this is going to be your second paragraph, and the best would be that you write the combination of these 2 paragraphs as the third paragraph. But since you're starting, this is your day 1, I want you to make this one as the third paragraph, this one as the fourth paragraph. And then comes the south pole of the letter. Why am I telling you this? Sometimes there can be 4 visits. That means you're going to make 4 paragraphs. What if there are 12 visits? Are you going to make 12 paragraphs? Of course not. So this is the most basic letter that can be given to anybody who just starts. So even my daughter can write 3 paragraphs separately. But the art is that, the way you manipulate information from one place to another. But since you're beginning today, I want you to make this one as a second paragraph, Feb 22nd. Then you make September 19th as a third paragraph, and February 8th as fourth paragraph, or February 8th as third paragraph, and this one as the fourth paragraph, and then the south pole of the letter. You get me? And you're not going to get it right. Of course, I'm going to teach you how to write, because if I tell you everything right now, how to mix and how to merge, you're going to get confused. So first, learn how to walk. And let me tell you, The way I've told you to do the letter, you're not going to get more than 300. Are you for PLAB or USMLE?
I'm for USMLE.
Okay, then 300 is going to be enough for you. Um, but anyways, what I'm trying to tell you is that the way I'm telling you to write, you're not going to get a very high score. And then tomorrow, when we edit your letter, I'm going to teach you how to make it a B band, like a higher level letter. And I'm going to make you rewrite this letter again because you're going to make mistakes tomorrow for sure. And don't worry about it because everybody makes mistakes. Yeah, Rupesh?
Yes, yes, sir.
Okay, so I'm going to send you this file to you in a while, everything with all the details, homeworks, and everything. But I hope you've understood whatever I've said so far. Okay.
Yeah, yeah.
Okay. Now let us go towards the speaking part. Now, what is speaking? What do we do in speaking? These are the expressive skills that we're focusing today. Tomorrow, after I correct your letter, tomorrow I practice a little bit of speaking with you. Then I'm going to introduce you to reading and listening both. So it'll be a full-fledged practice from tomorrow and afterwards. Okay, so see. Now what happens in speaking? Let's do this. Tin tin pass tin pass. 3 3 5. Easy to remember, right? Nowadays, this can also be 3 to 5 minutes, to be honest. These are minutes, eh? So what happens in the initial 3 minutes? Let me increase the size. There. The initial 3 to 5 minutes, it's a warm-up. So if you have booked the OET examination using a passport, they're going to check your passport, they're going to check your photo, they're going to check, oh yes, is that the person who booked for the test? They're going to ensure that. If you've used your citizenship card, they're going to check that citizenship card as well. They're going to make you sign the person who is sitting in front of you, acting to be a patient, not examiner per se. In IELTS, you have examiner. In IELTS, the person who's sitting in front of you has full rights to mark you. But in OET, the person who's sitting in front of you is not an examiner, but rather interlocutor. What is the meaning of interlocutor? The person who does the acting of the patient. That's it. It's a speaking role play. Outpatient setting. Most of the speaking is going to be outpatient setting for you. OPD, clinic. Yeah. So initial 3-5 minutes, they can also ask you a few questions like, okay, can you tell me a little bit about yourself? Why did you decide to be a doctor? What made you become a doctor? I mean, what are your career aspirations? Can you tell me about your family and all those things? But the good news is that it is not evaluated. It has no value whatsoever. You can even sing a song. Nobody's going to say anything to you. Now, that's a joke. Of course, you don't do that. But it is the end result. It's not evaluated. That's the most important point. Not evaluated, like 0. Yeah. After that, the main deal begins. This is the task 1, and this is the task 2. That means we have 2 tasks. I'll show you in a while. So 3 minutes of prep time and 5 minutes of speaking time. And again, 3 minutes of prep time and 5 minutes of speaking time. Yeah. So in total, you have to speak for 10 minutes. And whatever you speak is going to be recorded in an MP3 format, and it goes elsewhere for evaluation. So eye contact is not important. I mean, you can just read the thing that is given to you, and you can make your own answers, and you can just speak well. That's what is needed. So let me say again, 3, 3, 5, 3, 5. So like 20 to 25 minutes sub-test. Okay? And we have 2 tasks. Let me show you what the tasks look like. So let me tell you the anatomy of the cue card. This is called a cue card. CUECARD. What's the meaning of cue? Cue means sanket. It's giving you a hint. Now you must be noticing here, Dr. Rupesh, that it has patient. Are you the patient? No. You're always a doctor. You're appearing for OET medicine. So who are you? You're the doctor. This is your part, and this is my part. You see, there's a line here in the middle. The upper half is going to be in the hands of the interlocutor, i.e., your examiner. So every day during the practice, I am going to be your patient. You're going to be my doctor. Yeah? Understand? So look at this. So this is the doctor part. This is the patient. And you're not allowed to see this. But I'm going to show you today just to to make you understand that it's a role play. So whatever I ask you as a patient, you have to reply, and whatever you ask me as a doctor, I have to reply. So it's a both-sided conversation, two-sided conversation. It's a dialogue. This is what happens in outpatient department, isn't it? In clinic. So here it says, now let us talk further. We have community health center. This is where the conversation is taking place. That means you're the GP. You're always the GP, by the way, Rupert. Always the GP. Then you're a doctor, and this is the background, and these are the tasks that you need to complete. And you should always underline, find out, check, explain, reassure, encourage, advise. So can you read it, please, just by yourself and understand it once?
Should I read it loudly?
No. Just by yourself.
Okay, I read it.
Already? Everything?
Yes.
Oh, that's very fast. So, okay, so see this. So you understand this thing that you're seeing on the screen, it's called a cue card, and this is going to be in the printed form in your hands throughout the conversation. And you get 3 minutes to prepare for it. Maybe it is going to sound a bit overwhelming in the beginning, but after 5 or 6 practice, you will get used to it also. So this is what it looks like. This is a cue card, yeah? So after this 3 minutes and 5 minutes, you get another one. You get another one. They'll give you another task fee. Completely unrelated. Yeah, that one was about tetanus vaccination. This one's about arthritic pain. Yeah, okay, you get this point, right? So
yeah, yes.
Now let me tell you how to convert the speaking into a functional speaking, what OET expects, and how to do that. So for that, I'm going to ask you to memorize few things. Okay?
Okay.
So I'm putting it on the screen. I'm going to send it to you later as a homework. You have to remember, you have to memorize. So note it down, Rupesh. A1, A4, B1, B3, C2, D2, D3, D5, E1, and E4. How many of them? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Yes.
You have to memorize. I'm going to ask you tomorrow. I'm
Okay.
going to explain you what it is. Wait, just note it down first. You have to focus on this. How to initiate a conversation? How do you begin the conversation? What do you do with the conversation? You're going to learn from here. Yeah? Have you noted?
Yes, sir, I have noted.
Okay, so see, what is A1? It's very logical. Greetings. Okay. Good morning, good afternoon, good evening. Hello, namaste. We do in Nepal, of course, namaste is not going to be acceptable for OET. Introduction means, who are you? Hello, I'm Dr. Rupesh. I'm your attending doctor here. I'm your general practitioner here. Nature of interview means, what are you going to talk to the patient? So you can also say, how may I help you? What is bothering you? Or you can say that, oh, I see from the notes that you are here to ask me a few questions about vaccination. You read that, right? Tetanus a while ago.
Yes, yes.
So you can make up that story. That's A1. And you must be noticing, why did I not mark A2? Why did I not mark A3? Because that comes for free. A2 means demonstrating an attentive and respectful attitude. I mean, after paying that much for the examination, don't you think you're going to be respectful to your interlocutor? You are going to be respectful,
Obviously.
isn't it? Obviously. So there's no chance that you're going to lose points from there. Of course, I'll tell you what is the meaning of being attentive also, but not now. Let us not put so much pressure on you. A4 means showing empathy and sympathy. Like, if the patient is happy, you become happy for the patient. If the patient is sad, you become sad for the patient. So if the patient says, oh, I've been having pain, you say, oh, I'm sorry to hear that. If the patient is saying, oh, I recently became a father, oh, I'm so happy. You're going to have a lovely family, something like that. That's the meaning of empathy. Yeah. After the B1, we have B1. These, the way they have written sounds so fancy, but actually doesn't account for anything, to be honest. B1, just write it on the notebook. B1 means chaso, right? Chaso, Nepali.
Okay.
It's a chaso of a doctor. Like Rupesh, I said, Rupesh, I've been having headache. And he said, oh, how long did you have the headache for? In the scale of 0 to 10, how would you rate your pain? Did you take any medication? Has it happened before? Is there anything that is bothering you recently? Where did this question generate? Where did it come from? That is the curiosity of a medical professional, a doctor especially. So what it
Yeah.
says is that when the patient comes, the cue card that you saw a while ago, you need to be able to create questions to show chaso. So the patient says, oh, I have tetanus. I think I have tetanus. And you say, oh, why do you think you have tetanus? What happened? How did it happen? How did you initially manage your wound? You ask those questions in a clinical setting. That is B1. You understand? I'll show you more. You know what? Like if I say,
Mm.
oh, I've been a smoker, you say, okay, how long have you been smoking? What makes you smoke? Have you ever tried quitting smoking? This kind of questions that follows. If I say, I have a pain here, okay, where is it? Can you show me with your index finger? Where is it? There. Oh, all right. So does it happen after eating, before eating? Has it happened before? Do you drink? These questions automatically come, isn't it, as a doctor?
Yeah.
That is what it means by B1. Tassel. B3 means giving a logical explanation, like telling the patient in that case, oh, no, you don't have tetanus. You don't have any problems in your jaws. You don't feel anything abnormal around your neck. And you've managed your wound very well. So I don't think you have tetanus. That is a conclusion summary. Yeah. Then we have C2. Let us not talk about this now. I'll tell you in the end. D2 means, this is a very important one, Rupesh. Very, very important one. B1, B3, and D2 are very, very important, and even E1 is very important. Uh, B1 and D2 are besties, best friends. How? B1 says, chaso dejanos. D2 says, ask open questions initially and close questions later. So we have 5 minutes of speaking. So minute 1, minute 2, minute 3 will be initial, isn't it?
Yeah.
So what D2 says is that it's better to use in open questions initially. Open questions means W-H questions, how questions, or any question that has a statement. Like, do you have a name? Closed question. What is your name? Is an open question. So
Yeah.
what I mean is, if you're already showing chaso, then why not to show the chaso with open questions? At least 2 or 3. In that way, you're getting point from B1 and D2 both, isn't it? That's what it means by D2. D3 means not using compound questions. Don't ask, okay, do you smoke, do you drink, and do you exercise? 3 questions. Don't do like that. Go one by one. Yeah. What about your vaccination history? What about this? Don't ask multiple questions at once to confuse the patient. That's what it means by D3. D5, let us not talk about it now. I'll tell you in the end. E1 also, you must be noticing, E1 also has initially, and D2 also has initially. That means you have to use this in earlier. So establishing initially what the patient already knows means, okay, do you have any idea what's happening to you? Do you have any idea what symptoms, what disease you might be suffering from? When you use this kind of statement in the beginning to check with the patient can say, oh yes, I have migraine. I Googled it. You're successful in that case. So E1 also you're going to score. E4 means, do you get me? Do you follow me? Are you with me? Are you following me? Are we on the same page? I'm doing that with you also. Are you understanding, Rupesh? That's E4. Now, what are C2 and D5? So any question paper that's a cue card is divided into 2 halves, according to me. Upper half and the lower half. And there is always going to be one agenda in a cue card. Yeah? Like, okay, get yourself vaccinated in that one. And once the patient agrees, you go toward the lower half of the cue card where there will be many suggestions. Do this, you read it, right? Wear this kind of shoes, protective layer, blah, blah, blah. There is always going to be suggestions. If I'm a smoker, oh, try to reduce. If I drink alcohol, try to cut down. If I'm obese, try to exercise. There's always going to be suggestion towards the end. So when the main agenda is complete and you're moving to the next topic, you should always be using C2. That's called signposting changes. Okay, let us talk about some precautions you can take. So when you start any statement with this, then the listener is going to know, oh, okay, the doctor is going to talk about the precaution. So making the patient aware of what the change in topic is going to be next is called signposting. It happens in the writing as well, regarding the discharge plan, regarding the medical history. So if you start a paragraph's first sentence with regarding the medical history, so what is the content of the paragraph going to be? Medical history? No.
Yeah.
The same thing. That's called signposting. Now, D5 means whatever you've heard from the patient, you kind of summarize and double check. Okay, so you told me that you've been smoking for 20 years and you smoke like 10 cigarettes a day? And the patient says, no, not 10, 20. So checking everything and then moving forward is called D5. So I'm not going to pressurize a lot in the beginning for D5, but all the other criteria you have to memorize, and I'm going to teach you one by one how to prepare. Yeah? Now what I want you to do is, I'll send this to you. After this, the cue card that we had just now, I want you to prepare a little bit, not in OET way, but how Dr. Rupesh will talk to me in real life. Like, where do you live?
I live in.
Okay. So look at this one. I'll send you this cue card. That's page number 1. And if this was happening for real, where you are in OPD in Janakpur and I'm your patient, how will you talk to me? I just want you to do it in a Rupesh way. And then I'm going to compare that with I'm going to compare that with OET way. And then I'm going to tell you the mistakes and the values of A1, A4, B1, B2. And then you'll exactly understand. So the task 1 that you have today is to do the homework of for the writing. Task 2, you're going to memorize the criteria. Task 3, you're going to practice this a little bit. And tomorrow I'm going to check everything. Then we move to reading and listening. Okay?
Sorry, sir. Should I write? What should I write?
I'll send you. Wait, the one that we were discussing. Remember the letter?
Yes. Yes, sir.
I'll send you the format also. Everything. Don't worry.
Okay.
So don't get anxious. Just write in any way you want, and then of course we're going to figure out everything from there. All right?
Yes.
Okay. So